Hello, today I'll be discussing congenital nasolacrimal duct obstruction. This condition happens when there is a blockage in the tear draining system. This condition most of the time happens approximately in about 6% of the newborns, and the most common cause is persistent tearing and ocular discharge in infants and young children, and most cases resolve spontaneously. Congenital dichostesis occurs less commonly but is associated with potentially serious complication, hence requires a timely referral to an ophthalmologist. So this is a diagram that is showing the lacrimal gland. From lacrimal gland, tears have come to the eye. Then we have the puncta, which is part of the drainage system. Then there is canaliculus, lacrimal sac. From lacrimal sac, they go through the nasolacrimal duct. Then from there we have the nasal cavity. So our discussion is under the name nasolacrimal duct obstruction. So when there is an obstruction under the nasolacrimal duct. So a blocked tear duct means your tear fluid cannot flow out of your eyes properly as it's supposed to. So these blockages can cause disruptive symptoms like watery eye, trouble seeing, and they can also increase the risk of infection. So because the tears are not draining as they're supposed to, there will be risk for infection. As you see in that picture, the right eye is having a little bit of discharges and also some yellowish discharge. So it's easy for someone to have infection because tears are not draining as they're supposed to. So babies most likely are going to get these, but adults also can get it. Fortunately, most causes are treatable and reversible. Your eyes need tear fluid for them to work properly because the tear fluid is there to lubricate the surface of your eyes and helps cornea to absorb oxygen. Tear fluid also contains immune factors that protect against or help your eyes recover from infections. So you can think of your tear system like the gutters. So if you have a house, there are gutters. If the gutters has something in their downspout, they will affect, if there's a blockage in the downspout, that will cause spillage because the system is not draining as it's supposed to. So the tear duct system, in a series of openings and a tube-like structure, is like that gutter. If there's a blockage, there will be spillage. So it's the same thing happens with the tear drainage system. So the route that tear fluid flows through is as follows. They start from the puncta. So each eye has two puncta, one on the lower lid and the other one on the upper lid. So they are like a drain in the sink or a bathtub, letting tear fluid flow out and into the canalicula. So that's the canalicula. From the puncta, they go to the canalicula. So each punctum drains into the canaliculus. Each puncta drains into the canaliculus. And from canaliculus, now we have the nasolacrimal ducts. So a nasolacrimal duct are the fine tube-like areas that tear fluid travels through. At the bottom of each tear duct, there should be a valve. So this valve is what is known as the valve of Hasner. This valve is just an opening that lets tear fluid drain into the nasal passage. Normally it opens on its own before you are born, but sometimes baby have valves that are not open yet. So if it's not opened yet, when the baby or the child is born, is referred to as membrane of Hasner. So that's the tear drainage system. You have the puncta, you have the canaliculi, lacrimal sac, lacrimal duct and the valve of Hasner. So the valve of Hasner is just down there. So some of the symptoms that the child will come with are things like watery eyes, crust build on eyelids or in the eyelashes. There's also frequent rubbing of eyes or around the face, redness and swelling, and also blurred vision. Swelling or redness of the tear duct or nearby tissues. Fever. So these are some of the infection symptoms that will tell you that there's an infection. There will be swelling and redness, fever, irritability, eye pain or sinus pressure, redness or irritation of the eyeball, especially the sclera. So what causes tear duct blockage? Number one, tear duct blockage is caused as a congenital, developmental congenital. So congenital tear duct obstruction usually happens because the child still has an unbroken membrane. So where the valve of Hasner should be. So that means fluid can build up inside the lacrimal duct. Over time, the accumulated tear fluid can cause the duct to expand. It can also lead to infection of the tear duct and other parts of the tear system. So other causes of tear duct blockages, we have infections. So if there is a chronic infection of your eyes or surrounding areas, can contribute to scar tissue buildup. So when this scar tissue build up, they can be a cause of narrowing and hence blocking the drainage. Number 3, injuries. Trauma to your face, eyes, nose can cause swelling and tissue changes around your tear system. So swelling or tissue changes affecting any part of the system can cause or contribute to blockage. The other cause is narrow tear duct. So sometimes your tear ducts are narrow when you are born or they get narrow during your lifetime. Either can cause or contribute to a blockage. The other thing is aging. So with age, then outlet gets narrower or there are changes that will contribute to blockage, aging. The other cause is tumors or growth. So this includes benign tumors that are non-cancerous or cancerous. So this growth can cause blockage in your tear ducts. So these are small mucus-filled pockets that can develop in the neighboring sinuses. For instance, the ethmoid sinuses. So when these are close to the system, they can cause blockages. The other cause is tear stones. These can form when tear fluid collects and hardens. If these are big enough, they can block the tear duct. So as we have said that babies have a higher chance of developing a blocked tear duct because the membrane at the bottom of the tear nasolacrimal duct does not open become the valve of Hasner. The membrane has not opened to become the valve of Hasner. So that is why babies have high chances of developing blocked tear duct. So some of the risk factor for a blocked tear duct: adults are more likely to develop a tear duct blockage if they have a history of chronic eye infection such as uveitis, glaucoma, sinus surgeries, previous cancer treatments such as radiotherapy and chemotherapy. So complications of a blocked tear duct. A blocked tear duct is just the kind of place where bacteria find it easy to grow. So bacterial infection or abscess are the main possible complication of a blocked tear duct. The infections can also affect your sinuses, eyes, and other nearby tissues. That is why treating and keeping the infection from spreading is very important. How can a blocked tear duct be diagnosed? Number one, by presenting symptoms. So you hear what the patient is complaining about by inspecting or feeling around the eye and the tear duct. The other way to check is by using a dye disappearance test. So this one uses fluorescein. So you put a fluorescein, then after a couple of minutes, about 5, then you check if the eye that you have stained with fluorescein maybe have a spillover of fluorescein, the fluorescein have not drained, then you know that there is a blocked tear duct. But if the tear duct is okay, you expect all the fluorescein to drain through the nasolacrimal duct. Management and treatment. Special massage technique that you can do at home. So this massage technique is usually all it takes to make the membrane pop open and become a valve. If the blockage does not get better with massage by the time a child has their first birthday, it is more likely they will need a different treatment approach. So there are other treatment approach apart from massage if the valve of Hasna is not opening about the first birthday that the child is having. So massage also is not likely to help adults. So other treatment are usually necessary to do. So some of these treatments that may be employed may require anesthesia. So there is dilatation, probing, and irrigation. So one of the simple approach to treat a